One of the worst things about Medicare is that there are so many pitfalls that can cost you a lot of money. That's why in this video, I'm going to show you the 7 expensive Medicare mistakes that can cost you hundreds, if not thousands of dollars. But the thing is, these mistakes are actually not all that hard to avoid.
See? It's not so hard.
Once you know about them, you can easily steer clear of them and save a lot of money on Medicare. I'm Calvin from PlanFit, and I've been helping seniors save money on Medicare for over 14 years now. And today, I'm going to show you exactly how you can do this. So let's start with number 7, which is only enrolling in Original Medicare. If you've done your homework, you should know by now that most people pair Original Medicare with either a Medicare supplement plan and a prescription drug plan, or they get a Medicare Advantage plan. This is because Original Medicare doesn't cover 100% of your healthcare costs. Medicare will only cover 80% of the costs for most items and services, and you're responsible for paying the remaining 20% out of pocket. Now, this might not sound like a lot on paper, but remember, there is no cap to the 20%. So if you get a serious illness or condition, you might find yourself spending $10,000 out of pocket, or maybe even, in a serious situation, $100,000 out of pocket.
Whoa, slow down.
Not only that, but Original Medicare also doesn't cover prescription drugs by itself. You'll need a prescription drug plan or a Medicare Advantage plan with prescription drug coverage to have coverage for prescriptions. And if you're taking meds, I'm sure you know by now just how expensive they can be. That's why it's so important to know that even though Original Medicare is an amazing insurance program, it can still cost you a lot if you don't get additional coverage. Now, if you want to learn more about your options, I do have a full video explaining how Medicare Advantage and Medicare supplement plans work, so you can check those out on my channel. Or if you'd rather speak to a professional to find the best plan fit for you, you can call or text us. But now let's move on to the next mistake, which is automatically enrolling in Medicare without comparing first. A lot of people assume that the moment they turn 65, they should enroll in Medicare, and most people should. However, if you are still covered by your employer's health plan or have some other kind of insurance, it's a good idea to study how the insurance interacts with Medicare first. Medicare works differently with different types of insurance, and a lot of times it's not wise to have them both. Now, Medicare has a PDF that goes over how it interacts with all kinds of insurance, such as COBRA, TRICARE, and VA benefits. I'll put a link in the description below. But I'll go over one example for you. And that's how Medicare interacts with your employer's health plan, because this is the most common. The important thing to note when it comes to this is how many employees your company has. If it's less than 20, then Medicare considers this a small group, and you should probably enroll in Medicare. The reason for this is that when you turn 65, Medicare becomes the first payer, and your small group health plan becomes the second payer. And if you aren't enrolled in Medicare, then you could get penalized. Suddenly, you could become the first payer, and you don't need me telling you how expensive that can get. However, if your company has 20 or more employees, then you don't have to enroll in Medicare. This is because Medicare will become the secondary payer, and a lot of times Medicare and group health plans insurance don't coordinate benefits very well. So you end up paying for 2 health plans when you really only need one. So in that case, we often recommend that you enroll in Medicare Part A, but skip the premium of Medicare Part B. Also, if you have coverage from a company that has 20 or more employees, you can usually delay enrolling in Medicare without facing any penalties. But that's a topic for later, so stay tuned. Let's look at the 5th mistake, which is not contesting your IRMAA bracket. Most people don't have to pay anything for Medicare Part A, which is your inpatient health insurance, but most people do pay a premium for Part B, which is your outpatient coverage. In 2024, the base premium for Part B is set at $174.70 a month. However, in case you don't know, Medicare also has a system where people who earn more also pay a higher Medicare premium. This is known as Medicare IRMAA, IRMAA, or Income Related Monthly Adjustment Amount. Here's a quick look at the IRMAA brackets for 2024. As you can see, if you're making more than $103,000 on your individual tax return, you'll have to pay an additional $69.90 a month for Part B. Now, you can argue for or against the IRMAA system, but one thing that catches some people off guard is that these numbers are actually taken from your tax return 2 years prior. So if you made over $103,000 in 2022, you'll be placed in a higher IRMAA bracket, even if you're making less now in 2024. And this catches a lot of people off guard because they retire around 64, 65 years old, which is also the same time when they first enroll in Medicare. So some people just accept the higher premium without realizing that you can contest it. Social Security allows people who go through life-changing events, including retirement or loss of income, to appeal their IRMAA bracket. All you have to do is call Social Security and they'll guide you through the process of submitting your appeal forms. Other life-changing events, including marriage, divorce, death of a spouse, or an employer settlement payment, or the sale of a home, they may also qualify. Even though not everyone will qualify for an exception, it's good to know about this because the jump from the first IRMAA bracket to the second IRMAA bracket is quite a big one. The next big mistake that I see a lot of people making is not enrolling in a prescription drug plan right away. If you're not taking prescription medications yet, you might be wondering, why should I enroll in something that I'm not going to use? But here's the thing. Medicare Part D prescription drug plans have a late enrollment penalty. If you don't enroll during your initial enrollment period and you don't have other creditable coverage, which means other drug coverage that's equal to or greater than Medicare Part D, then you will get this penalty. And the worst part, it is a permanent penalty. So it won't go away after you pay a certain amount. You'll have to keep paying it as long as you have a prescription drug plan. That's why it's so important to know when your initial enrollment period is. For most people, it is the 7 months surrounding their 65th birthday. It starts 3 months before the birth month, it includes the birth month, and then ends 3 months after the birth month. If you miss this, you don't qualify for a special enrollment period, and you'll start getting a penalty. The penalty is an extra 1% of the national base premium, which is like the average premium, per month that you were not enrolled, and then it's added onto the premium of your drug plan. Now, if you look at the numbers, it might not seem like much, like what's 1%? If I went 10 months without, then that's 10%. But remember, this adds up. It's about 30 cents per month that you went without coverage, and that quickly adds up when you've had multiple months without coverage. That's why if you don't have creditable coverage like TRICARE or VA or an employer plan, it's very important to enroll in a standalone prescription drug plan or get a Medicare Advantage plan with drug coverage during your initial enrollment period. However, keep in mind that this isn't the biggest late enrollment penalty yet. I'm saving that for number 1. Before we take a look at the top 3 mistakes, let me just jump in here to say that if you're enjoying this video, please leave a like. This supports our channel and helps this video reach more seniors who may be prone to making these Medicare mistakes. Also, we have a lot of simple and informative Medicare videos coming up, so hit subscribe if you want to see those as well. All right, let's get back to the video. Another mistake I see people making is not properly comparing their Medicare Advantage or Medicare supplement plans. If you don't do this, you may suddenly realize that your preferred doctor doesn't take your Medicare Advantage plan. Or maybe when it's time to pay your Medicare supplement plan premium, you don't know that you could be saving $2,000 by having a Medicare Advantage plan instead. Or maybe you took a Medicare supplement plan and you took an expensive one. That's why it's so important to compare your plan options. Now, Medicare supplement plans and Medicare Advantage plans are the 2 major additional coverage options for original Medicare. And there is a lot of discussion here about which option is better. Here on YouTube, you may find several influencers really hating on Medicare Advantage plans. You'll find some of them saying that absolutely nobody should enroll in it, which, funny enough, is mostly because they're not licensed to sell Medicare Advantage plans in the first place. Also, the influencers who are licensed sometimes find that the regulations to sell Medicare Advantage plans are just too much of a hassle, so they push their viewers towards Medicare supplements instead. But keep in mind that about 52% or more of people with Medicare are enrolled in a Medicare Advantage plan. And only about 20% of the people with Medicare have a Medicare supplement plan. So next time you find someone on YouTube bashing Medicare Advantage, keep in mind that they probably don't have your best interest in mind. And that's not to say that we recommend Medicare Advantage over Medicare supplements. What we recommend is that you have an unbiased agent who can explain the pros and cons of both. So that's why instead of listening to general ideas and umbrella numbers about why Medicare Advantage is bad or why Medicare supplement plans are overpriced, do the comparison in your area. Because there are arguments to be made on both sides. In some areas, there won't be enough doctors around for good coverage on a Medicare Advantage plan. While in other areas, the high premiums for a Medicare supplement plan can completely wipe out any savings that you would have on claims and going to the doctor. Marrying the idea that a Medicare Advantage plan is always cheaper can be an expensive mistake, as well as believing that Medicare supplement plans always provide better coverage. Now, there are 2 ways that you can compare what plans are actually available in your area. One is using Medicare's Plan Finder tool. Here you can enter your zip code, choose a Medicare Advantage plan or Medigap plans, which is just another name for Medicare Supplement plan, and this will give you an overview of the plans available in your area. Now, it's important to keep in mind that Medicare's Plan Finder tool doesn't show you all of the details, so you'll need to call into the planned carrier to learn more. That's all really complicated, so instead, I recommend that you do this. Speak to a licensed insurance broker or agent. We can give you unbiased advice on which plan is a best fit for you. You tell us your specific situation and your specific needs, and we'll go over all of your options in your area to find the one that works specifically best for you. The best part, you can do this all at no cost to you. That's right, insurance companies actually pay us to help you, and they don't raise the cost to you. So if you need professional help, call or text us at 877-360-6565. That brings us to mistake number 2, not shopping for plans every year. Whether you've signed up for a Medicare Advantage plan or a Medicare Supplement plan plus a prescription drug plan, there are going to be changes to your plan every year. Medicare Advantage plans might change some of their terms, while prescription drug plans can change their costs as well as the drugs that are covered in their formulary. So no matter which route you take, every fall you're going to get a letter from your insurance company that goes over the changes to your benefits. It's really important that you review these changes. Too many people just renew their coverage without checking anything. And then they're surprised the next year when a bill comes and it's a lot higher than it was the last year, even though they're on the same plan. That's why you should always review your plan. Every year, around September or maybe early October, you should receive your annual notice of change, or ANOC, A-N-O-C, Annual Notice of Change. This letter goes over all the changes for your Medicare Advantage plan or your prescription drug plan for the following year. A lot of people don't review it. It's a pretty intimidating document, and sometimes it's really long with all kinds of numbers and data and stuff, but not reviewing it is a big mistake, because if you don't, you might find yourself with much higher costs the following year. That's why you should review it. And if you spot something you don't like, maybe your prescription meds going off the drug plan's formulary or something like that, then you should shop around. Every year, Medicare gives a few periods where you can switch your Medicare Advantage plan or your prescription drug plan. You can do this during annual enrollment period, which is October 15th to December 7th every year. You can also do it during Medicare Advantage open enrollment period, which is January 1st to March 31st. And there are sometimes some special enrollment periods when you can make changes. But make it a practice to really review your plan's changes and shop around too, because this is a really great way to make sure that you are saving money always on your Medicare. Now for the number one Medicare mistake that people make, unfortunately, all the time: missing your initial enrollment period. So many people are unaware that it's critical to enroll at the right time, because, like Part D, if you miss your initial enrollment period, you could end up paying a permanent late penalty. Only this time, it can be much more expensive than a Part D penalty. Again, for most people, the initial enrollment period runs 3 months before their birth month, the month of their 65th birthday, and 3 months after their 65th birth month. If you miss this enrollment period, then you're going to get a permanent penalty on your Part B premium. The penalty is an additional 10% for every year you delay. So if you enroll 2 years later, you'll have to pay an additional 20% on top of your Part B premium for as long as you have Medicare, which is essentially the rest of your life. The Part B premium for 2024 is set at $174.70. So even if you just delay it for 1 year, that's an extra $17.47 a month, which quickly adds up to about $210 a year. An extra $210 that you don't have to pay, but now you made a mistake and you're going to be paying it for the rest of your life. What makes matters worse is that the Part B premium increases almost every year. So by the time you get to 80, 90 years old, you are going to be paying even more per month because it's a percentage above the Part B premium. Now, if you miss your initial enrollment period, there are special enrollment periods, but you have to qualify for them. The most common special enrollment period for Medicare is for those who still have group insurance to their coverage, as long as their employer has 20 or more employees. For a full list of other special enrollment periods, you can check out Medicare's website, and I'll leave a link in the description below. But for everyone else, it's critical to enroll during your initial enrollment period. This is something that a lot of people regret not doing, and easily the number one most expensive mistake that people make when it comes to Medicare. So there you have it. Those are the 7 biggest Medicare mistakes that can cost you a lot. My hope is that this video makes you avoid all 7 of these and you get the best coverage for yourself at the lowest cost. If you have any questions, go ahead and leave a comment below. Or if you need professional help finding a great plan fit for you, then call or text us at 877-360-6565, and we're happy to help you. Other than that, thank you for watching, and I'll see you on the next one. Bye-bye.